Hey, make sure you're not overstretching your injuries. It's not a statement you hear commonly, right? Now let's break down a couple scenarios where stretching might not be your best option and some good alternatives to help you navigate that injury. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy, where we specialize in the conservative management of musculoskeletal pain and injuries, meaning that our treatments do not entail the use of drugs or surgical interventions. Now, the couple injuries that I'm referencing here would entail certain cases of tendinitis as well as muscular strains. So let's walk back to tendinitis for a second. So things such as a high hamstring tendinitis or an Achilles tendinitis, the way that the tendon interacts in that joint, it can get compressed. So in the case of, say, an Achilles tendinitis, your calf may feel tight. But when you go in for a traditional calf stretch where you prop your foot up in a door frame or on a curb and lean into it, you might feel a great stretch on your calf, but what you're doing is also compressing that tendon against the heel bone. So it's helping one thing, but might be aggravating another. The same is true with a high hamstring. The way that that tendon interacts with your sit bone, when we're in a position like a traditional hamstring stretch where we bend forward to touch our toes, that tendon gets compressed around that sit bone. So again, you feel a nice stretch through the hamstrings, but you're also irritating the tendon a little bit in the process. Now, the other injury type that stretching might not be the most advantageous is a muscular strain. So envision your classic hamstring strain where you have an athlete running down the field and they all of a sudden feel a clench or a quick tightening of their hamstring. It feels a cramp sensation. It feels very tight, and the natural instinct is to want to stretch it out. Now, the nuanced part of this is that the body has perceived something as a threat, whether that muscle got over fatigued or overextended in a way. The brain has opted to protect that spot and clench and protect. Now, if we try to override that and just drop into an aggressive hamstring stretch, it's you fighting your body's own protective mechanisms. And all that's going to do is make your body kind of double down on what it was already doing. So in one way, you will be stretching the fibers, but in the other way, they're also going to be fighting back on you. Now, with these injuries, there are great alternatives instead of stretching. So in one way, we want to boost the circulation in that area. So things like foam rolling or a massage gun are great in these cases because we get to boost some blood flow, relax some tension in the muscles without really having to move those muscle fibers much. So we're not necessarily shortening or lengthening them. So it feels very safe to the body, and this can be a great way to navigate those early stages of an injury. The other option we have here is finding a movement or exercise that puts a light load or a light stress through that muscle. So as an alternative to, say, the traditional hamstring stretch, bending forward to touch your toes, what we could do instead is, say, a glute bridge, to where we're going to get some activation of that hamstring, but we're not going to get a ton of shortening, lengthening of those muscle fibers. And in the case of, say, a high hamstring tendinitis, the way that the hips are oriented in a glute bridge, we're not going to be wrapping that tendon around the sit bone. So finding movement alternatives, ways that we can get a good stress through that muscle or tendon, is a great way to help the body kind of bring down its natural defenses or its protective mechanisms, but also a way to add strength in an area that might have been a little inhibited prior and could have been something that was contributing to the initial injury. Now, if you are navigating through an injury yourself right now, whether that be a case of tendinitis or a muscular strain, I would invite you to check out our website at TruMotionTherapy.com, where we have more information and resources, as well as the ability to schedule an appointment with one of our providers. And we would love to help you navigate that injury and help you come back stronger than before.